Hey everyone, in this video I'm going to show you how to do a diaphragm release. So I have done a lot of different videos on how to release the diaphragm using cupping techniques, which I will link below. And then I've also shown you how to use Franklin balls, which I don't have them here, but Franklin balls when you're laying on your stomach to release the diaphragm. In this video, I will show you how to use your hands to help release tension right here. So just as a review, your diaphragm is a 360-degree muscle. Your diaphragm can be tight for different reasons. It can get tight throughout your pregnancy as the baby grows. It can also be tight if you are under a lot of stress or just hold a lot of tension in your body. Now, having a tight diaphragm can affect a lot of different things. It can cause urinary incontinence. It can affect the way you breathe. It can affect your stress levels. It can also really affect your digestion and the placement and alignment of your abdominal organs. So for this diaphragm release, I'm just going to lift up my shirt so you can see, but you're going to find your lower ribs. So your lower ribs are angled about at a 45-degree angle, and you have a left lower rib and a right lower rib. Now your diaphragm is located if you scoop inside of that rib cage. So you just want to find that lower rib angle. You're going to sink your fingers down, and then you're going to dig them underneath those ribs. So what I like to do is I like to use one of my hands. I like to cup that area. It might help to actually bend your knee so that's a little bit more slack in your tissue here. So you're just going to sink your fingers down and you're going to sink up towards your armpit, and you're going to maintain pressure there as you breathe in and out. So we're going to have you inhale and exhale. Inhale again and exhale. Now for me, I can kind of dig in pretty nicely. A lot of people who have a lot of tension here, I won't be able to dig in that deep. I won't even able to like really scoop up. A lot of people with a lot of tension here, even if I just kind of sink in and scoop up a little bit, they already feel a lot of tension and tightness there. So if that's you, don't feel like you have to really push really hard. Just kind of sink in and scoop up until you start to feel some resistance, and then maintain pressure there as you do 5 to 10 deep diaphragmatic breaths. Now your diaphragm is located along the underneath the entire lower part of the rib. So you can work here, 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 here. So you can work along the whole area, and you want to do this on both sides. This is a really great technique if you struggle with constipation or slow colon motility, fullness, abdominal distension, or bloating. Cupping is also a really great way to release the diaphragm, which again, I kind of talked about before. But again, this is a very useful technique to add on if you need some additional help. So if you have any questions, please feel free to leave a comment below and I'd be glad to answer them.